What if I told you that one small valve in your heart could determine whether you live with constant exhaustion or get your energy back and add years to your life? Today, we're talking about aortic valve replacement, what it is, when you need it, the different options available, and what recovery really looks like. If you or someone you love has been told they might need this surgery, stay with me. This could change everything. What is the aortic valve and why it matters? Your heart has 4 valves. One of the most important is the aortic valve. It sits between the heart's main pumping chamber, the left ventricle, and the aorta, the large artery that sends oxygen-rich blood to your entire body. Every time your heart beats, this valve opens to let blood out and closes to prevent blood from leaking backward. Now imagine a door that either won't open fully or won't close properly. That's exactly what happens in 2 common conditions. Aortic stenosis, the valve becomes stiff and narrow. Aortic regurgitation, the valve doesn't close tightly, causing blood to leak backward. Over time, your heart works harder and harder. Eventually, it can't keep up. And that's when doctors start talking about aortic valve replacement. Symptoms you should never ignore. Here's the uncomfortable truth. Many people ignore the early warning signs. At first, symptoms are subtle. Fatigue, shortness of breath during activity, dizziness, chest discomfort. But as the valve problem worsens, symptoms can become serious. Fainting, severe chest pain, swelling in legs, irregular heartbeat. With severe aortic stenosis, once symptoms appear, survival drops significantly if untreated. That's not fear-mongering, that's medical data. The good news? Aortic valve replacement can dramatically improve both quality of life and survival when done at the right time. When is aortic valve replacement necessary? Doctors don't recommend surgery lightly. You may need aortic valve replacement if your valve disease is severe, you're experiencing symptoms, tests show your heart function is declining, the risk of waiting is greater than the risk of surgery. Your cardiologist will use echocardiograms, stress tests, and sometimes CT scans to make that decision. And timing matters. Too early, and you take on surgical risk unnecessarily. Too late, and heart damage may already be permanent. This is why regular monitoring is critical if you've been diagnosed with valve disease. Types of aortic valve replacement. Now let's talk options because this isn't one size fits all. There are 2 main ways to replace the valve. One, surgical aortic valve replacement, SAVR. This is traditional open heart surgery. The chest is opened, the damaged valve is removed, a new valve is sewn into place. It's been performed for decades and is extremely reliable. Best for younger patients, those already needing other heart surgery, low surgical risk individuals. Recovery usually takes several weeks. 2. Transcatheter aortic valve replacement, TAVR. This is less invasive. Instead of opening the chest, doctors insert a catheter, often through an artery in the leg, and guide a new valve into place. No large chest incision, shorter hospital stays, faster recovery. Originally, TAVR was only for high-risk patients. Now it's used even in lower-risk individuals, depending on age and anatomy. But here's the key: not everyone qualifies. Your heart structure, age, and overall health determine which procedure is best. Mechanical versus biological valves. Once the method is decided, there's another choice. What kind of valve? Mechanical valves. Made from durable materials, can last decades, ideal for younger patients. But you must take lifelong blood thinners to prevent clots. That means regular monitoring and bleeding risks. Biological, tissue, valves. Made from animal tissue. Usually last 10 to 20 years. Often don't require lifelong blood thinners. They may wear out over time, meaning another procedure could be necessary. This is where age plays a major role. Younger patients often lean mechanical. Older patients often choose tissue valves. There's no perfect option. There's only the right option for you. What is recovery really like? Let's be honest. Aortic valve replacement is major heart treatment, even with TAVR. After open surgery, hospital stay about 5 to 7 days. Full recovery 6 to 12 weeks. Cardiac rehabilitation strongly recommended. After TAVR, hospital stay sometimes 1 to 3 days. Recovery is faster. Many patients feel improvement within weeks. You may experience temporary fatigue, mild pain or soreness, emotional ups and downs. That's normal. The heart has been under strain for years. Now it's adjusting to normal blood flow again. Many patients describe something powerful. I didn't realize how bad I felt until I felt better. That renewed energy can feel life-changing. Risks you should understand. Every procedure has risks. Let's be clear. Possible complications include bleeding, stroke, infection, irregular heartbeat, valve failure, rare but possible. However, for severe aortic valve disease, the risk of not replacing the valve is often much higher. Modern techniques have significantly improved safety outcomes. This is why choosing an experienced heart team and hospital matters. Life after aortic valve replacement. Here's the encouraging part. Most people return to normal daily activities, exercise as guided, work, travel. In fact, many feel stronger than they have in years, but lifestyle still matters. If you want your new valve to last, control blood pressure, manage cholesterol, stay physically active, eat a heart-healthy diet, keep follow-up appointments. Your surgery fixes the valve, but your habits protect your heart. A realistic perspective. Some people delay surgery out of fear. They think, I'll wait. I'm not that bad yet. I don't want open heart surgery. That hesitation is human, but untreated severe aortic stenosis can lead to heart failure and sudden cardiac death. On the other hand, thousands of people every year undergo aortic valve replacement and go on to live active, fulfilling lives. The key is early diagnosis and proper medical guidance. Knowledge removes fear, and preparation reduces risk. Let's summarize clearly. The aortic valve controls blood flow from your heart to your body. Severe narrowing or leakage can be life-threatening. Aortic valve replacement is often the only definitive treatment. You may have options, traditional surgery or TAVR. Valve type matters, mechanical versus biological. Recovery is real, but so is renewed energy and longer life. This is not just about surgery. It's about giving your heart a second chance. If you found this helpful, don't keep it to yourself. Someone in your life may be silently struggling with fatigue, chest pain, or shortness of breath, not realizing it could be valve disease. Share this video. Subscribe to BalancedMotion Health for evidence-based, practical heart health guidance. And most importantly, if you or someone you love has been diagnosed with aortic valve disease, talk to a qualified cardiologist. Early action saves lives. Your heart works for you every second. It deserves your attention. We'll see you in the next video.